Dr. Monica, you're welcome. It's a great honor to finally meet you. And I must say, this session of Health Focus, I had to ask some of our viewers of social media to send in questions. And actually, one Benson is one who was like, get her contact, please. Talk to her off Facebook. So tell me about, your experience in West Africa. You've just come back. How was it?
It was overwhelming. One, this Ebola had already, just in the one district where I landed, it was already more than what we have ever had in Uganda. Two, there were no systems. There were no organized systems for responding. At first I thought, there should be some leaders. I need to find the leaders, and they will tell me what they have been doing and I see how to contribute. After about 2 days, I realized I have to take the lead. I realized I was the leader I was looking for. So I began from zero. My first job was to convince them to be part of this.
So here is one from Facebook, Ebiachu Tom Van Jams. People get names of Facebook. So here goes the question. In a situation where medical personnel are dying of the epidemic, what really kills doctors even when there is protective gear? That is one. Then also maybe Edward Chimera comes in. What pushes them even in the lowest of moments?
About 5 days when I got there, the only Sierra Leonean doctor who was involved died. That was extremely scary for everybody. All my team resolved they didn't want to work. It took a lot of leadership skills to convince them to continue working. Yes, we are scared like everybody else, but I equate our work to that of the military. For me, that's one of my issues. I get to know my enemies. I get to know the diseases. I have to know more than what's written. I look at my fallen colleagues and I tell myself they should not die in vain. There should be a time for victory. What drives us is passion for work, passion for our profession. I don't know how to explain this, but Florence, for me, when there is an outbreak, I want to go there. Well, the rest of you want to run away. In Sierra Leone, of course, it was so heart-wrenching to see entire families wiped out. You find a house locked. There were 15 people. They are all dead. There's a family where 24 people all died. They left one child. About why they get infected, the doctors. One, sometimes they get infected at the beginning of the outbreak when they do not know that this is the disease before it is confirmed. Two, some doctors don't get to know the entire details about the disease. Sometimes it's accidental. Like Dr. Lukuya of Uganda who died, he knew everything and his practices were okay, but because of that patient, he got infected. I need to mention there that Ebola affects patients' brains. Some patients start very early looking like they're mad. So they may act irrational. They can even tear that dress, that PPE. Then others are really accidents, like they are trying to fix a line, then they prick themselves. Now we think that we may have had some PPE which was not very protective, it was not very effective. So some people ended up being exposed. There has been a lot of investigations in West Africa.
From Twitter, Dr. Isma Khan Muzami, he says, congrats to all the medics for their selfless work. He appreciates. What lessons can Ugandans draw from the West African epidemic? And then still, Sivan Ismail, Twitter, Uganda managed to contain that deadly virus. How come it escalated in West Africa?
Uganda should not become complacent. The issue of Sierra Leone and why the disease has gone that much is weak leadership. It's not technical capacity. Let's continue training our people. Let's also continue keeping them motivated. The other thing is education. In these countries, the education level is very low. Literacy rates are very low. So the people can't understand the messages. So we need to really support things like this universal secondary education, universal primary education. You may think it's not doing much, but educated people are better.
So, Doctor, you said something quite interesting which captured my attention for a minute there. Like you say, you worked not even knowing that someone was even noticing. And I see you were really noticed. You were known as a female warrior. You were given a name, Dr. Konya. It became a household name. So clearly, the people noticed.
They also gave me a second honor They made me a paramount chief. I want to say that I'm not the only Ugandan who has been in West Africa. In fact, there is another colleague of ours called Dr. Tai. She also played leadership role in Liberia, and she was voted one of the people of the year. So Ugandans took the best team in terms of human resource. There were thousands and thousands of people from all over the world, but I'm sorry to say many of them did not know what to do, especially in the field. What will remain a big troubling question is how a disease can be allowed in the presence of all the international experts and international resources to expand and kill people that much.
A big question indeed, because the disease has claimed very many people, over 8,300 according to WHO as of this January. But according to Dr. Monica, this has been underreported. It is estimated that this is only about 30 to 40%. Dr. Monica is willing to spearhead the fight against Ebola in Uganda and all over the world. Thank you for those of you who have been part of the question time with the doctor. I am Florence Naluyimba, NTV.